Akshay.
Yeah, very good afternoon, everybody. And we are going to start this virtual event on the launch of the uh, framework document for welfare measures for the transgender community in India. So, this is the occasion where we have brought together key stakeholders from government departments, community representatives, our partners who have all worked together in this area for the development of the transgender community. So, to start the proceedings of the meeting, first I would like to request Dr. Manish Pant, Chief Health and Governance Unit at UNDP, to deliver the welcome address and also tell us the background of this report. Dr. Pant, over to you.
Uh, Thank you, Chiranjeev, and good afternoon, everyone. I would like to welcome you all for this very important event. I would start by welcoming Shri R. Subramaniam, Secretary, Ministry of Social Justice and Empowerment, Shri Pradhan, Secretary General, National Human Rights Commission. I would also welcome Shri Alok Saxena, Additional Secretary and Director General, NACO, Shrimati Radhika Chakravarti, Joint Secretary, Ministry of Social Justice and Empowerment. I would like to welcome Dr. Muni Raju, Deputy Advisor, Niti Aayog. I would welcome Dr. Bilali Kamra, Country Director, UNAIDS. Mrs. Shoko Noda, our resident representative for UNDP in India. Welcome our partners in our work, joint work together, Mr. Vivekanand from the Humsafar Trust, and Dr. Venkatesan Chakrapani from C-Sharp, and also above all, my friend and ex-colleague Zainab. Thank you for being here. I welcome all different stakeholders from the national, state, and district level who have joined us virtually on a relatively short notice, including representatives from the government departments, academic institutions, partner organizations, civil society organizations. I welcome you all. The Transgender Person Protection of Right Act of 2019 and rules of 2020 are significant landmarks, to ensure human rights and basic entitlements of the transgender community in India. Under the Act, provisions have been made for the welfare of transgender communities in areas like health, education, skill development, housing. At UNDP, we have been working amongst the marginalized populations, including LGBTQ, both globally in many countries. And in India, we have been working with the Government of India to further the rights and welfare of these communities for over 30 years now. In 2020, last year, the Ministry of Social Justice and Empowerment requested UNDP India to work on a framework for the welfare of the transgender community in India. And in collaboration with Humsafar Trust and Center for Sexuality and Health Research and Policies, a C-Sharp, we developed the framework document, which we are releasing today. The framework document is a result of broad consultative processes involving stakeholders from national, international, state levels. Overall, there were 8 consultations involving 282 stakeholders, including 57 representatives of the central ministries and state governments. The process also involved a detailed desk review of the current central and state government programs, schemes for the general population and transgender people, and barriers faced by the community in accessing these schemes. The review also involves studying policies, laws, schemes, and welfare measures for the transgender people in other parts of the world. In the end, I hope this framework document will provide the roadmap for stakeholders for a successful implementation of the welfare measures for the transgender community at grassroots level. I am happy to receive any feedback, comments, and that we can work on and assure the Ministry of Social Justice and Empowerment and Government of India of our continued support on this very, very vital area of our work. Thank you so much. And back to you, Chiranjeev.
Thank you, Dr. Pant, for setting the tone of the meeting and providing the background of this document. So now, before we move to the address by our distinguished guests, we have this important moment where we want to launch this document. So, as we all know that because of the sudden surge in the COVID situation, we have to last minute make it a virtual event. So, we have tried to share the document with as many officials as possible. So, whoever has the document, I would request you to basically hold it and release it, and so that we can declare this document open. So please. Thank you everyone. To take the proceedings further of the meeting, we thought as UNDP and our partners that although we are discussing the overall work as part of this transgender welfare, but we should also share some of the key recommendations of this work that we have done. So for that matter, our partners CSARP and Humsafar Trust during their address, they will try to cover some of the key areas which have been covered in this report. So to start with, I would request Dr. Venkatesan Chakrapani from CSARP to give his address, and he will be addressing mainly the health sector welfare measures that we have addressed in this framework document. Dr. Chakrapani, over to you.
Thank you, Dr. Saranjeev. Good afternoon, everyone. I am glad that I have been part of this important initiative. I hope that the strategies and objectives proposed in the framework document are soon realized in action with support from the government and other key stakeholders. I will try to project my slide. Yeah, 1 second. So I will try to cover this in 5 minutes, mainly focusing on the health chapter. This is the overall goal of the framework. Transgender persons and people with intersex variation lead a quality life, contribute to society, and realize their rights. So the framework has 5 chapters: health, education, livelihood and skill building, housing and food, and personal safety. So I will focus on the health chapter. Mr. Vivek Anand and Ms. Jana Patel will cover the rest. So in the health chapter, there are 5 objectives and several key strategies. The first objective focuses on providing gender affirmative care for transgender people and providing competent care for people with intersex variations. Gender affirmative hormones can be made available in government hospitals, especially if they can be included in national essential medications list. Given the lack of expertise on certain gender affirmative surgeries in government hospitals, it is crucial that training need to be provided to health providers in government hospitals, especially training in conducting some specialized surgeries like vaginoplasty for trans feminine people and meta-idioplasty or phalloplasty for trans masculine people. Such surgeries can be offered at free or subsidized cost in government hospitals. Cost can be covered by government or private health insurance schemes or through welfare schemes. The objective 2 focuses on reducing discrimination in accessing general health services, training providers, and integrating transgender health in medical curriculum or key strategies. One important strategy is to issue guidance on transgender sensitive intake forms, admission procedures, and restroom access. The third objective focuses on trans inclusivity in current national health policies and programs. This involves training and conducting trans inclusivity audit, just like gender audit, to ensure that the information provided and services are trans inclusive. For example, in cancer screening programs, cancer screening for trans masculine people and trans feminine people need to be integrated. Objective 4 focuses on ending HIV epidemic among transgender people by 2030, which is an international goal and also a national goal. The current coverage in HIV prevention for trans feminine people is about 67%. So strategies to scale up coverage are crucial. If you look at the last bullet point, which I want to focus on, currently the HIV interventions for trans feminine people provide services only for adults. But as many trans people, they leave their parental homes at a very early age, providing HIV prevention services for trans adolescents or legal minors is crucial. Objective 5 is on creation and use of research evidence on trans health. Most of the current research focuses on HIV and trans feminine people. Research is thus also needed on other health-related topics and among trans masculine people and people with intersex variations. To monitor and address health inequalities, gender identity information need to be collected in national health surveys, and also support is needed for conducting trans-specific health surveys. The document suggests which strategies can be implemented by which ministries and departments. Obviously, these are suggestions. Each chapter also contains suggestions for potential implementation arrangements between various ministries and departments and other bodies like, say, National Council of Trans People or Transgender Welfare Boards. So that was the brief overview of the health chapter. I think I will stop there. Thank you very much.
Thank you, Dr. Venkatesan, for giving a snapshot of this important chapter on health that we have addressed in this document. So thank you so much for that. So moving ahead, next we'll request Mr. Vivek Anand, CEO Humsafar Trust, to present his address. Vivekji, over to you.
Thank you so much, Chiranjeev. And I take this opportunity to thank UNDP India for getting Humsafar Trust on board and C# in developing this very crucial framework document for transgender welfare in India. This will be shared widely with various stakeholders. Most prominently, it will be shared with the Ministry of Social Justice and Empowerment. And we look forward that these recommendations are brought on board. I'm very happy that I have been given, like throughout the development of this framework, there were two areas where I was concentrating. And thanks a lot to the teams for giving me an opportunity to talk a bit about education and livelihood, food security. One of the things that this framework proposes is enabling inclusive and supportive learning environment. There, we are talking about formulation of a national anti-bullying and harassment policy, because this is going to play a very prominent role. Training and sensitization of teachers about challenges faced by gender diverse children and children with intersex variations. Development of curriculum that is inclusive of gender diversity in different disciplines. Setting up of all gender inclusive infrastructure in educational institutions, allowing for exercising one's choice according to their preferred gender expression in the dress code, uniforms, hairstyles, accommodation, and sports. I may not be able to cover all the recommendations, but it's there in the report. But educating and supporting families to facilitate access to education for gender diverse children. So we have to understand that it has to begin at school levels, because I have time and again said this, that Humsafar has done a study where 65% of trans children drop out of school before they reach 8th class. And one of the chief reasons is bullying. So that's a great area of work for us to concentrate. In food security, I would say improving access to food through addressing policy and implementation gaps in food distribution. One of the chief recommendations that we are making is incorporating transgender persons as a distinct category in the targeted public distribution system. Antyodaya Anna Yojana, food security schemes for the poorest of the poor families, and other state government food security schemes. We are also making some recommendations around ensuring nutritional security, targeted cash transfers or ration support during emergency situations such as pandemics and economic showdowns. So yeah, so I would kind of stop over here. Thank you very much. I would ask Zainab to take it forward from here.
Yeah, thank you, Vivek, for your remarks. So as he has mentioned, next I would like to request Jana Patel, and she brings a unique context to this work because she represents the community, also being a member of the National Council for Transgender Person, and she has also contributed in this report. So Jana, over to you for your remarks.
Thank you, Chiranjeev, and thank you, Vivek and Dr. Venkatesh, for setting the context for this. So I have a very challenging task ahead to kind of, weave a community perspective as well as give a author's perspective to the framework. I'll be mostly focusing a little bit on the economic security as well as personal safety and well-being, because I think that, these two are elements that basically complement each other. If you look at the context of a country like India, where trans persons, especially those from the trans feminine or those who belong to socio-economic groups like hijras, kinnars, etc., have been basically excluded from participation in all walks of life, whether it's social, political, economic, educational, so on and so forth. And a key to bring them to the mainstream and a key to look at inclusive development today is basically using a three-pronged approach if it comes to economic empowerment. One is helping create a very strong digital footprint to both tackle identity as well as document-related challenges. I've been working in the sector for more than 20 years now, and I realized that a lot of trans people, whether they are gender non-conforming, trans-masculine, feminine people, etc., have been, continue to remain in the back doors because the documentation related challenges continue to infringe any of the rights-based approach that you would want to take. And hence, when the government is rolling out the census 2021, the socioeconomic status of transgender persons should especially be captured in it to give us a more clearer vision in terms of where we want to achieve. Also, in terms of advancing economic opportunities and social protection to access to finance and services in a holistic manner, whether it is coverage of transgender persons to various schemes, include them in poverty elevation, housing and pension schemes, also sensitization right up till the panchayat level on persons' rights and responsibilities of trans persons and the duty bearers. And this will basically be achieved through the combined participation of the bureaucracy, of the judiciary, and also of the NGOs, CBO, and other stakeholders right up to the grass level. And wherever it is not possible to look at an entitlement-based model, this is something that UNDP has always been promoting, to look at entrepreneurship, to look at entitlement, to look at employability, but also looking at how alternate income generation options, whether it is access to microcredit, through formal financial institutions, to improving employability. And this is, of course, looking at skills building and support for financially inclusion interventions. There was one bit which I think I happen to have the good fortune of working with the private sector. But, if I look at certain protections, even though the Transgender Protection Act outlays very specifically that we need to have anti-discrimination policies, this has been far from achieved because organizations still do not look at it as a compliance related issue like they would do, say, for example, for prevention of sexual harassment at the workplace or the RPDWD Act. So I think a stronger degree of sensitization and handholding is required, especially when it comes to issues of trans persons. Also, from a personal safety and security purpose, we need to look at how are we going to look at minimizing harm? In the last 1 year, and there are several cases where we flagged to the ministry about intra-community violence. And this has come up with very heart-moving, videos, pictures, etc. And sometimes there is just enough information or empowerment of the victim. Hence, a victim-centered legal and healthcare approach, including mental health and access to various habilitation services, providing them to an integrated approach sensitive reporting by media, especially on violence and sexual violence. And if, like in Maharashtra and other states where there is a scheme for financial assistance for survivors of violence or sexual assault, then these intend to be covered also for the transgender population. So, I mean, having said this, what we also wanted to look at is this document providing us with enough guidance for the National Transgender Council, for the various transgender welfare boards to actually do a comprehensive reviews of laws and policy framework which affect transgender people, and basically the complementary approach in it. So these were some of the recommendations which I thought from an economic empowerment as well as a personal safety security, which needs to go forward. And finally, I think it's the 7th anniversary of the Nalsa judgment, something which UNDP and me in personal capacity have been part of. I think the community's expectations are growing by the day. And because they see a very supportive institution like the Ministry of Social Justice and Empowerment, like the National Human Rights Commission, which has actually stepped up to the mandate, put a core group in place, the Planning Commission, which is so proactively engaging with members of the LGBTIQ community, and of course, our firm anchor, which is NACO, which has from the last 20 years, managed to pull various community groups together and ensured a non-health approach to looking at issues and mitigating the impact of health and HIV among various marginalized communities. Thank you.
Thank you, Janav, for your specific points which highlighted the key recommendations from the report. Next, moving forward, we would like to invite Dr. Vilali Kamara. He is the country director for the joint UN team on HIV/AIDS, and request Dr. Vilali to give his address. So over to you.
Thank you, Mr. Chair, and dignitaries from, of course, Ministry of Social Justice and Empowerment, dignitaries of NACO, dignitaries of, I will say, our own UN, my colleague Shoko. Let me really thank you very much for this opportunity to really bring us together to look at how we can operationalize the transgender bill or act into something which can really benefit our people. And that, from my perspective, is really critical and very important. And I want to recognize really your efforts in the past many months to really bring actually our people together to really look at this issue in a very comprehensive way. I would like just to say a few things which I believe are important. And I have heard my colleague Vivek talking about children dropping out of school, transgender children dropping out of school. I will say that transgender children are dropping also out of families. And that's what my colleague Venkatesh has put on the table. So the reality is that when we look at the transgender bill, we have a clear understanding, or act, we have a clear understanding that it is about the complete and total health and well-being of the transgender people in India. Therefore, I really would like us to consider this step, this framework, as a framework which will really help us to look at the transgender issues in a continuum. It means that from childhood to adolescence to adulthood and to old ages. That is critical, and it is very important, because at every single step, transgender people will need specific attentions which they really deserve. As human beings, they deserve as part of their human rights. A continuum of care, psychosocial, human rights, social protection, legal protection are fundamentally necessary if we really have to address the environment where the transgender are growing, from family level to community level to schooling to employment and workplaces to work legal. And as Jinabu was talking about, and health and well-being issues, as Venkatesh was talking about it, which is medical and non-medical. And of course, civil rights. People have the right to marry. People have the right to adopt children if they want. Those are realities which we really have to consider. because it is my conviction that half measures are not effective and we have to go full force. And I'm sure that the leadership of the Minister of Social Justice and Empowerment is critical, but not one ministry can do this. We need many more ministries to really put hands together to really help us to address this issue. From the Minister of Women Development, Women and Child Development, to the Minister of Defense. We really need all of you to really work with us and see how better we can really address those issues. And of course, with the support of NACO, as Zainab has said, which has been one of the critical mother and father for all of us in terms of really how to address our issues. It is only working together and focusing our efforts at the district level, as Niti Aayog has done with us in terms of working, empowering the district level. We really can work together to make sure the Transgender Council can really guide us, the Minister of Social Justice and Empowerment, and NACO, and Niti Aayog can really help us working with other ministries to make sure that we are attending all the needs of our transgender people. It is important that we keep that in mind. It starts at childhood level, it ends at death. And we have to have our people treated with dignity at every single step, treated with respect, treated with human rights at every single step. That is important and it is critical. Our transgender people are full of potential. From childhood to adulthood to adolescenthood, they do a lot. They know a lot. We have to help each other. We have to really make sure that we live a dignified life. And I will always remember what Lakshmi had told me. I want a shelter, it is true, but I want my own house. That is very true. So those are realities which we really have to keep in mind as we are moving forward and to make sure that our transgender people will have their place in our society. And I want to finally say that there's our, how to say it, a little contribution as UNH and our big contribution through UNDP, which is really our lead agency in this area, which we are really supporting and happy really to see how Manish and the team are really getting the process moving forward, working with all of us to really make sure that we have some little contribution. During those processes, we have created what we have called the social entrepreneurship for the key populations. And today, we have a 3 major project which we are supporting for transgender people. And one of them is really building skills in the rice industry. And the second one is really building skills in beauty salon. And of course, the last one is really the development of digital skills so that our transgenders will be part of that very competitive area, building apps, building a website to really make sure that their issues are known, their issues are understood, and beyond. And I want to really thank again the Minister of Social Justice. I want to thank NACO. I want to thank the National Human Rights Commission. I want to thank Humsafar. I want to thank really all of you for really putting this meeting together and to tell you together it is possible and UNH is with you. Thank you very much.
Thank you, Dr. Vilali, for your points, especially mentioning the importance of following the continuum of services, the specific role of the agencies, and the importance of intervening at the district level. These are really critical points. So thank you for your remarks. Moving forward, next, we would like to invite Ms. Soko Noda, Resident Representative, UNDP India, to deliver address. Soko, over to you.
Thank you very much. Mr. Subramanyam, sorry, can't really pronounce that, Mr. Secretary, and also Ms. Chakrabarti, Joint Secretary, both from the Ministry of Social Justice and Empowerment, Mr. Pradhan, Secretary General and CEO, National Human Rights Commission, Mr. Saxena, the Additional Secretary and DG of National AIDS Control Organization, Dr. Munir Raju, Deputy Advisor of Niti Aayog, Ms. Patel, member of the National Council for Transgender Persons, Dr. Chakrapani, chairperson of Sharp, Mr. Anand, CEO of Humsafar Trust, and of course our very, very good friend, Dr. Bilali from UNA, country director, and all the colleagues and friends. It is my great pleasure to be here with all of you to launch this framework document on transgender welfare in India. Today is a very historic day for transgender community. If you remember, 7 years ago, on this very day, the Supreme Court of India made a landmark decision to grant the legal recognition to trans people in the country. Recognizing the trans community legally was a momentous milestone. It empowers them to meaningfully participate in society. But has it been enough? Definitely not. It's still far from enough. What is practiced in reality on daily life is what matters in the end. If we want to address the stigma, discrimination, and violence that transgender people face each day, we really need to engage with them, provide them financial support, and most importantly, first, listen to them. LGBTIQ communities, in particular the transgender community, are one of the most marginalized in the country. They often face humiliation, even at home, let alone in schools and at workplace. They can rarely find employment in mainstream occupations. It's extremely difficult for trans people to trans people in India to get skills training and jobs because of social taboos, customs, and strong prejudices dominating at workplaces. This pushes them into high-risk professions that leave them vulnerable to violence and diseases like HIV. Gender identity should never be a barrier for someone to enjoy or anybody to enjoy fundamental rights like access to healthcare, education, and employment. All human beings are born, we are all born free and equal in dignity and rights. Trans people have these same human rights. We at UNDP recognize these rights, have very important, we attach importance to these rights and have been working with the government of India to further the rights and welfare of this particular community, LGBTIQ, for almost 3 decades, 30 years. Last year, UNDP India recommended draft Rules of Transgender Act through a series of stakeholder consultations. The Ministry of Social Justice and Empowerment had then requested us to develop a framework, which we have now done in collaboration with Humsafar Trust and the Center for Sexuality and Health and Research and Policy. I would like to really thank all of you, the colleagues from and then officials from the ministry, from the C-Sharp, Humsafar Trust, also, of course, Dr. Bilali and his team, National Human Rights Commission, NITI Aayog, and the National AIDS Control Organization on this path-breaking endeavor that aims to uplift and emancipate the transgender community. We also hope that this framework will help to provide a roadmap for the ministry's SMILE scheme that seeks to support marginalized individuals for livelihood and enterprise. Ensuring that transgender community in India is empowered socially and economically will help them to have access to better education, employment, and health services, and will enable trans people to live with dignity in an equal society. So once again, congratulations, and thank you very much for all the partnership.
Thank you very much, Soko, for sharing your insights on the challenges of the transgender community and how this document will be useful for all the stakeholders to ensure the welfare for the community. Thank you so much for your remarks. Moving ahead, next we would like to request Dr. Moniraju SB. Sir is the Deputy Advisor in the Niti Aayog. Sir, over to you for your remarks.
Thank you, Chiranjeevi, and good afternoon, one and all. It's a great opportunity. In fact, I appreciated the work done by UNDP, Humsafar Trust, and Center for Sexuality and Health Research and Policy. You have done a wonderful job. In fact, the work is already started when Niti Aayog formulated the strategy document, where we have incorporated some of the strategies to address the needs of the community. So I just would like to highlight some of the major suggestions or recommendations or strategies which we have suggested are that to provide identification of transgender persons in all government and non-governmental records by introducing a separate column to include the third gender. Because if you see many cases, we miss this point. So we have come up with such a strategy and we have insisted all the states to incorporate the column for the transgender people, and also sensitize the communities towards the challenges and needs of transgender persons, because we all know that the transgender people are facing a lot of problems, and that community needs to be sensitized. So in this regard, civil society organizations are invited to ensure that they should create sensitization among the communities, and also create a forum for the active participation of transgender persons at all levels of governance, because we miss that transit opportunities for the transgender people, especially if you take any kind of at least in the government jobs or in the politics at the local self or the urban local bodies and the rural local bodies. So these things we have made a strategy so that they'll participate. Their participation will also ensure in the governance systems, and put in a place an institutional mechanism to effectively implement programs for transgender persons. The institutional mechanism is lacking in many states. Some of the states are not so active to come up with an institutional mechanism. Of course, some states are advanced and some states are lacking that kind of institutional mechanism. So in fact, these issues were discussed during the governing council meetings where all the chief ministers were invited for the interactions, and also determine the number of transgender persons and map their socio-economic status. So that's a missing point, because we are yet to map the socio-economic status and also to design customized policy interventions. So this enumeration and mapping can be carried out by the, in fact, we requested Social Justice Ministry and the Ministry of Statistics and Program Implementations. So there are some, in fact, sample surveys are done by the Ministry of MOSPI, so that they have mapped the issues, and also mandate the provision of housing and community services to accommodate at least 50% of the transgender persons. We all know that the transgender people facing problem for the housing. So this provision needs to be built in the government program so that their housing needs are addressed, and also formulate and implement a scheme for establishing residential schools in all districts for transgender persons. This is one of the major strategy which needs to be done, and because the transgender, as we all discussed, that bullying happens at the school level, but still to address such kind of issues, we need to have residential schools exclusively for the transgender children or the students, so that that kind of discrimination or harassment or some kind of ill treatment can be addressed, and they can be given all needed educational opportunities. And also design a scheme for providing skill and employability training to transgender persons to integrate them with the mainstream society, because skilling is one of the major problem, because transgenders are other side is they're not well educated, but providing them additional skills to acquire dignified employment opportunities, then definitely the skill provisions are required. Yes, we know that there are certain schemes which provide the skilling opportunities, but we need to enhance number of schemes and also ensure that everyone, every transgender person get adequate skilling and engaged in self-employment or in the wage employment with the dignified standards. And also launch a centrally sponsored scheme to provide pension to transgender persons above 60 years. We all know that transgender persons are missing this, that they don't get any kind of course, they are covered under general scheme, but exclusive scheme, there is no exclusive scheme, so that we have insisted that there should be an exclusive scheme, because there is no one will be there to take care of them. So ultimately, that social security scheme from government can definitely address to their financial needs, and also ensure Aadhaar and direct benefit transfer based implementation and monitoring of social security programs. So these are the major provisions or strategies which we envisaged in our strategy document. I again thank UNDP and team. So you have come up with a very wonderful report, and this report can be eye-opener for all the implementing agencies and also to the ministries. And in fact, for us also, Niti Aayog, which is a policy-making body, so that we can insist upon and we can ensure that these strategies or the suggestions and recommendations included in this report can be implemented in its true spirit. With this, thank you, Chiranjeev Singh and all other team members. Thank you so much.
Thank you, sir, for your remarks. Next, I would like to invite Srimati Radhika Chakravarti. Madam is the Joint Secretary, Social Defense in the Ministry of Social Justice and Empowerment. And ma'am is basically leading on this work on the welfare of the transgender community from the ministry. So ma'am, over to you for your remarks.
Yeah, thank you, Chiranjeev. And thank you very much to all the dignitaries who are present here. Wonderful suggestions. The speakers before me had made so many suggestions. It almost sounded like they're coming out of the scheme we had already worked out. So glad to hear these suggestions. It's a very tall order, in fact, I must say. But what I would like to emphasize is that the ministry is totally committed to the welfare of the transgender persons, even after the Nalsa judgment, which is about 7 years now. If we have a look at the last 1 year, what all happened in the last 1 year, starting January 10th, 2020 till date. So you would find that a lot of work had happened for the welfare of the transgender community, starting with the Transgender Protection of Rights Act, which has been formulated. And after a series of deliberations and discussions, the act has been passed by our parliament and came into effect on 10th of January 2020. That's a wonderful start to begin with, and followed by the rules wherever there was anything which needs to be explained about the act, or the notions or the different perceptions the community had about the provisions of the act have been clarified in the rules. The rules again is a very well documented concept, which after deliberations with the community members and the society at large, and after having put in the public domain couple of times and also pre-publication in the Gazette, the outcome is the rules which you all have gone through, and it has been widely appreciated in the different forums. So the other thing, I am just giving a recap of what all happened in 1 year, because 1 year, I think for so many things to happen, I really am very glad to be a part of the entire exercise. And then after this, National Transgender Council have been formed. So we have all these eminent transgender persons who are the members of this council. And we had our first meeting, and our second meeting is scheduled next month, where we discussed, the council is supposed to advise the ministry or the government on the policies, programs, and legislations and the project which would benefit the transgender community. And another very important thing, which is very important according to me, is the national portal for transgender person, which does not require a transgender person to go to the office of issue in order to get a transgender certificate and an ID card. That I think, it's gives a lot of dignity to the transgender person, that they don't have to go anywhere and make any request to anybody. Now that this portal is being augmented, and this portal, several features are being added, like the Garima Greh, the shelter home monitoring would be done through this portal, and various to come with any other ID card to be issued or any other DBT transfer to be made, because so many things are in the pipeline. Everything would be done through this portal, which would be a very, very transparent mechanism, which would go a long way in benefiting the transgender community. So coming to SMILE, which has already been mentioned here, and a lot of components of the SMILE, Dr. Muniraju had mentioned, the suggestions made by the Niti Aayog is almost covered in that. And I'm pleasantly surprised with the Ms. Shoko Noda, talking about SMILE, which is a 200 crore scheme for the welfare of transgender persons, where the focus is going to be on sensitization of the society at large and the parents especially, to ensure the well-being of the children, and also to the transgender community as to what is in for them in the act and the rules, or the what the government has provided already and what government intends to provide for the community members should be very well aware of. So we are going to very shortly launch a social media campaign program to sensitize the various sections of the society, including the community itself. And the topmost priority would be given to the health, of course, of the community members, followed by education, where we would look at the scholarships, both the pre and post matric scholarships, which would encourage the children who are already admitted into the schools to pursue higher studies, and that there are no dropouts there. So not only economic support to the education of the transgender children, but also to address the issue of dropouts, as pointed out by Dr. Bilali, is that we are going to have a board in every school which would look at these kind of issues coming up from the children. Sometimes it could be the teachers who are not sensitive enough to deal with certain issues. Sometimes it is the peers who are not sensitive enough to deal with the issues. So any such issues arising in a school which would make the child drop out from the school or studies will be addressed by this board, and we are going to insist. In fact, it is a part of the rules that this board is a mandatory component in the school administration. The third component, which we are going to emphasize through our scheme, is that the economic empowerment and the skill development of the transgender community members, for which we are going to organize a workshop of the community very shortly, where we are going to call for the experiences of the community members as to what are the activities actually we should look at, and make a skill development modules which would benefit the community, and subsequently how to give the economic linkages to the community to enable them to stand on their own feet and also contribute in a productive way to the economy of the country. So these are the few basic focuses that the ministry so far did, and in future the ministry is going to do. And what I would request, or what I have in my mind, is probably in the next sessions, what we should look at is how each ministry would be contributing, because it's a complete convergence. When we talk about the welfare of the transgender community, it's a complete convergence of the ministries we are looking at. Dr. Kamara has already pointed out, how all various ministries should come together, and Ministry of Health and NACO are already strongly into it. And we have to probably seek the convergence from the other ministry too, like education, like women and child, and like legal affairs or legislative department, because there are certain issues related to marriage or adoption which will be looked at different ministries. So how can a strong convergence be worked out is should also be looked into. So finally, I would conclude by thanking the UNDP for taking it upon themselves to come out with a framework of documents for the welfare of transgender persons, and launching it today on this forum, and also sharing it with us. And we would definitely go through the report and do the needful. Thank you very much.
Thank you, ma'am, for your remarks, and especially thankful to you for enlightening the audience about the SMILE schemes and the details about it. So that will be really helpful for other stakeholders to plan the way forward. Next, I would like to welcome and to give his address, C. Alok Saxena. Sir is the Additional Secretary and Director General, National AIDS Control Organization, Ministry of Health and Family Welfare. Over to you, sir.
Good afternoon, friends. Shri R. Subramaniam, Secretary, Minister of Social Justice and Empowerment. Shri Bimbadhar Pradhan, Secretary General, National Human Rights Commission. Ms. Radhika Chakravarti. Shri Muniraj SB, Deputy Advisor, Niti Aayog. Now, you have a list on Zoom, so I'll go alphabetically. Chiranjeev, Dr. Venkatesh Chakrapani, Mr. Rajavani, my brother, Dr. Bilali, Dr. Manish Pant, Ms. Shoko Noda, and Vivek and Zainab. I'm extremely happy, and it gives me extreme pleasure to see this or to release jointly this framework document for conceptualizing, designing, and implementing welfare and well-being measures for the transgender people. This has actually not come a day too late. But as you know, NACO for almost 30 years, under the umbrella of Ministry of Health and Family Welfare, imagine 1992. This must have been some sort of a subterfuge that in Ministry of Health at that time, we were dealing with and leading those set of populations which were, as I always say, on that other side of that thin line, which divides between what is in this country legal or illegal, what is legitimate and illegitimate. NACO has been working with key populations like the female sex workers. That work still remains illegal in this country. With the MSM, the men having sex with men, that group, again, this was illegal till 2018. Also with people who inject drugs, and last but not the least, transgenders. These are populations which are invisible at times, or which is the society decides not to look at them. But if we meet many of our old, not as an age, but people who've been working with us for long, transgender people, many of them acknowledge that NACO was the first home they had outside their homes, and many of them actually did not have any home at that time. So we've started the journey together from there with transgender people, with the community, and we've grown together, and no one is happier than Ministry of Health and NACO, particularly when now the transgender community has a legitimate home and a division in the Ministry of Social Justice and Empowerment, looking after various needs for their welfare and well-being, and not only that, getting a conceptual framework document made. As Dr. Chakrapani made initially the small presentation indicating what all is required. So I think Zainab also said initially that NACO worked in a very non-health manner, so I would add to that, in a very non-prescriptive manner, in taking everyone together, in taking decisions collectively. The thing in NACO is that even when we change the regimen of drugs for people living with HIV, it is done with the collaboration and consent of people who have to consume these drugs. So that is a level of involvement that NACO has of all the people who are affected by the HIV. But beyond what was said in one particular slide about HIV and the role of NACO for the welfare of transgenders and inclusiveness, I would say that our focus has always been on the sex, on the beyond the sexual the primary route for HIV/AIDS remain the sexual route, but our emphasis has been broader health apart from just the sexual route. So it was blood initially. It is now emphasis, particularly after this pandemic, on mental health, on how we handhold people, particularly those who need it most. Also, the key populations, as I said, that whose requirements NACO caters to, there is an overlap in the sense that people who inject drugs could also be sex workers, transgenders could also be in sex work and also injecting drugs. So it's not a very clear demarcation between various groups. They are all overlapping, and we need to take care of all their needs. That is, if one is on drugs, then you need to have harm reduction strategies there, de-addiction strategies there. If one is in sex trade, apart from being a transgender person, then you have to have those kind of interventions. So this is the overall thing that we look for the health of transgender people. In fact, in India, amongst the key population, after the people who inject drugs, the second set of population which has the highest prevalence, that is 3.14%, that is among the transgender persons. As of now, December 2020, almost 46,000 TG population were covered through 290 of our prevention, the targeted intervention programs. As you're all aware that NACO works in an extremely targeted manner, giving packages of services to each set of population that they need. Also, with the enactment of the HIV/AIDS Prevention and Control Act of 2017, one of our legal responsibilities is to make sure that stigma and discrimination is done away with, is discouraged, and is stopped. Now, with this, we were the first when we started NACO, when we started the targeted intervention programs, to collectivize, to bring transgender persons as a group, to collectivize them so that they could negotiate from the larger group of people for their own benefit. And I think to a great extent, when in Ministry of Social Justice and Empowerment, today the transgender leaders, some of them are in national and international celebrities, when they come and when they negotiate, some of it is also the hand-holding and the training that NACO gave them initially. It was not NACO, I stand corrected. In NACO, they gave themselves initially. So now if I go specifically towards the health-related asks in this report, in this framework document, many of the things we are doing, we'll continue to do. Perhaps it will bring focus. But I think when I read the document as someone who's been engaged with this program for last 4 years continuously, is that Ministry of Social Justice and Empowerment, as Radhika stated a little while ago, will have a tall order. They'll have to make packages for health, for mental health, for counseling, for support group, for peer support. And in NACO, we know that Social Justice and Empowerment Ministry is now doing a much bigger job, and they have a much bigger mandate. But we are acutely aware of the fact that much of it starts with their own bodies. And if it is that, then it is health. Whether it is talking to them about it, whether it is making them realize that finally they are the ones who will take the decisions about their existence, about their body, about what should be done, where should they stop, what is the kind of identity should they take. So this is a bigger job where we have to actually, each one of these persons, when they, when a child or even an adolescent or even at a later age, when somebody realizes that there's a being trapped in a body there's no congruence between them, then the person needs to talk to somebody. It may, mostly we have seen, it may not be the family. So can we create these support groups, which we did for MSM population at the beginning of the National AIDS Control Program, where many of them came out, talked to each other. Vivek is, what shall I say, Vivek, a relic of that time, or a representative of that time. So there were many, who were encouraged to come out, face, and then that's how, the MSM community is where it is today. So similarly, the problems and the issues with the transgender people are much bigger. They're much more complex, because it talks about, the psychiatric, inputs. It talks about physiology. It talks about health. It talks about their own self-esteem. It takes about. So all these things we need to do together. Ministry of Health on its own, we are doing things, but time has come where we work collectively together, and the idea is to develop an inclusive community where stigma and discrimination is shunned, and where the real worth, the talent of each individual is brought out, whether it is through education or skilling or both, and making socially productive individuals and leaders. And we always salute the leaders that the transgender community has thrown up, because they've come up the really hard way, where they had nobody, not even their families, to support them initially. And they are the ones who actually are going to lead this. We can only provide small packages to help, but eventually how it grows, how it eventually impacts, will depend on what they tell us. And with these words, there's one more point that I have to tell you, and that is about what Dr. Chakrapani said about legal minors. Now, this is a touchy issue with Health Ministry. We don't, NACO particularly, we do not legitimately legally deal with underages, as we call them. But it doesn't mean that services are not provided to them. Now, there could be an issue about how we do that. But the important thing is the services should reach the people who require them. We do them for underage sex workers, because a child could be trafficked at the age of 11, and by the time she's 14, she's HIV positive. So testing, services, prevention, all these things are given to them. But it is, if I use the word, that it is done, it is done through the program without bringing focus on it. The idea is services should be reached, but underage or below the legal age minors, giving them services would remain an issue. What I suggest is Minister of Social Justice and Empowerment make a comprehensive package, like we have done for people who inject drugs. So there, the therapy, the harm reduction therapy is given within the legal framework. Some such thing can be worked out, but it is easier said than done, but I'm sure that we'll be able to do that. So with these words, I end my statement today, but I'm really glad to be part of this. And I know that a whole lot of work remains to be done. Thank you very much.
Thank you, sir. Thank you so much for sharing the journey of NACO, and along with the journey of the key populations. And we are sure, as stakeholders who are involved with the NSAP for a long time, that NACO will continue to play a key role in ensure that the welfare measures for the transgender community are reaching the last mile. Next, I would like to invite Sri Bimbadhar Pradhan. Sir is the Secretary General and Chief Executive Officer of the National Human Rights Commission to deliver his address. Sir, over to you.
Yeah, thank you, Chiranjeev. Sri R. Subramaniam, Secretary, Ministry of Social Justice and Empowerment. Alok Saxena, Additional Secretary and DG NACO. Radhika Chakravarti, Joint Secretary, Social Defense. Dr. Muni Raju, Deputy Advisor, Niti Aayog. Soko Nodaji, Resident Representative, UNDP. Dr. Bilali, Country Director, UNAIDS. Jainab Patel, National Council for Transgender Persons. Vivek Anandji, Humsafar Trust. Dr. Chakrapani, CSAP. Dr. Manish Pant. Ladies and gentlemen, I will be extremely precise. Lot of ground has been covered, but each one of us is aware that the transgender community in India are the most marginalized sections, and they face challenges to access basic entitlements such as health, education, housing, and there is also the prevalence of the stigma and discrimination. And whatever NHRC has done, I will be extremely precise, but Radhika has covered a lot of ground, and Government of India has done lot of interventions in the year 2018, 2019, and 2020. Whether it is national portal for transgender persons or the Gary Magria, and the government is planning that these shelter homes will be in 10 cities. There will be 13 shelter homes and it will be covered in 10 cities. It has been opened in Vadodara, Gujarat, and now there will be a complaint officer. There will be a designated person, whether at the district level or the state level, there will be a complaint officer for the transgender persons. And there will be a transgender protection cell under the district magistrate and the director general of police to monitor the offenses relating to transgender persons. And whether about welfare schemes, medical facilities, SMILE, I am not going to repeat it. And above all, the National Council for the Transgender Persons at the apex level is advising the government for monitoring the policies, for redressing the grievances of the transgender communities. And each one of us is aware that whatever will be the offense, the imprisonment for, at least if I remember, it is for 6 months, can be extended up to 2 years and with fine. So lot of ground has been covered, whether it is legal framework, the act or the rules. Now coming back to this framework, before I go to the framework, what we did in National Human Rights Commission, there was a national level conference on 26th of February 2020 at Bangalore. Then we have 3 meetings relating to LGBT community, 3 core group meetings. And during the pandemic, the National Human Rights Commission has issued an advisory on 16th of October 2020 for the national government and for the state governments. Now, coming back to this very framework, I think I must convey my sincere thanks to the UNDP India and to the Humsafar Trust and the CSAP. This framework covers a lot of welfare measures. Now it is our responsibility, whether at the national level, whether it is the Ministry of Social Justice or the Women and Child Development or the Ministry of Health or the Ministry of Law and Justice or the state governments level. So national and the sub-national governments, it is our responsibility to take it to the last mile. And I would appreciate that this framework gives us practical, doable suggestions to implement the welfare measures in the areas of health, education, economic security, housing, as envisaged under the Transgender Persons Act 2019 and Rules 2020. Therefore, if I have to just tell one line, this document is a huge milestone to support the national and the sub-national governments in the rollout of the welfare measures. Once again, I congratulate the UNDP team, Humsafar, CSAP, for providing a roadmap to reach the last mile for the transgender community in India. The Act of 2019, the rules of 2020, and this very framework offers insights, practical measures, short-term, medium-term, and long-term interventions for improving the welfare of the transgender persons. Let's work together for a transgender inclusive India. Thank you. Thank you once again.
Thank you, sir, for your remarks and telling us the broad overview how we should move ahead in this endeavor. So thank you for your guidance. Uh, we had the consent of Sri R. Subramaniam, Secretary, Ministry of Social Justice and Empowerment, for attending this meeting, but his officers just informed us that sir is not well today. So we thank him in absentia for his guidance in initiating this framework document. So basically, to summarize and sum up, it is my privilege to offer the vote of thanks. So we'd like to thank all the dignitaries, senior government officials, partners from development partners, civil society organization, community representative, all who are present today. We thank you all for sharing your insights and inputs on this framework document and the way forward for us to support the development of the transgender community. We also thank all the stakeholders who had contributed extensively during the stakeholder consultation to develop the document. So we had more than 300 people who have participated in this consultation, including some people from different countries of the Asia Pacific region. So we thank them for their contribution in developing this comprehensive document. And we hope that the development of this framework document is just the beginning. And as many of our distinguished guests has mentioned today, that we all must work together as a team to ensure the effective implementation of the welfare measures for the transgender communities in India. So with that, thank you all, and please take care and stay safe in this difficult time. So with that, we can close the meeting.
Thank you. Thank you, Chiranjeev.
Thank you, sir. Thank you.
Thank you.
Thanks a lot, everyone. Thank you, Alok sir.
Thank you.
Thank you.
Thank you. Thank you.
Thank you, sir.
Thank you very much.
Thanks, brother.
Thank you,
Thank
Dr.
you.